Imagine a sharp pain that occurs every time you eat your favorite food. That would be awful. Well, if you have an injury to your teeth that hasn't healed properly, this could occur. In day-to-day thinking, tooth injuries don't cross our minds until it happens to us. Having pain that occurs when eating is awful and unpleasant. Toothaches can be a very big headache. Whenever a tooth injury does occur, it is a serious issue. According to Lauren Witchenberg's dental trauma case study, a tooth avulsion is among the most common and serious dental injuries. According to the American Association of Endodontists, more than 5 million tooth avulsions occur a year. A tooth avulsion is the complete displacement of a tooth out of its socket. American Academy of Pediatric Dentistry. Lauren Wilgenbush also states that the healing of an avulsion tooth often presents a challenge and depends on the vitality of the cell layers along the root surface. In Wilgenbush's case study, an account of a 13-year-old patient with an avulsed tooth is provided. The 13-year-old was performing a basic activity, riding her bike, when she fell. This is an instance that supports the fact that tooth avulsions can happen in an instant and out of nowhere. In the patient's account, the physicians and the staff at the hospital placed her loose tooth in milk. According to the American Association of Endodontists, it is important to only rinse dirt off the tooth with water and soak with milk. Milk preserves the tooth while awaiting treatment. Water can only be used to clean. The root surface of cells cannot tolerate water for extended periods of time. American Association of Endodontists. It is important to learn how to maintain your tooth once it has an injury because the tooth's health is critical to the replantation process. If the tooth is not healthy, the health of the tooth after replantation can suffer. According to Nisaman J. and Sien D. 2010 tooth avulsion, complications after replantation of an avulsed tooth are common and have conveyed incidence rates ranging from 57% to 80%. Emmerich and Wazowski of 2010 state that complications may arise during the next several years of regular dental exams, including ankylosis, excessive mobility of the tooth, resorption, discoloration, infection in the pulp, and reinclusation of the tooth as a result of root placement, resorption, and analysis. As we follow the patient's story, we can see the replantation was temporarily successful. The patient later chose to have teeth implants. Teeth implants are artificial, but they are sturdy. The patient also struggles with gum surgeries. They were unsuccessful. The medical staff decided that in her case, it would be best to use pink porcelain crowns to treat her gingival recession. The patient fully recovered from all her surgeries and had a result of beautiful teeth and gums. However, it was a long, hard process for her and her physicians. In other cases, problems can still occur even after implants. In Lauren Wilgenbush's dental trauma case study, she states that there are 3 diagnoses that can be made in regards to the health of dental implants. Healthy is when there is no clinical signs of inflammation. Implant mucositis is characterized as a local inflammation lesion within the soft tissue and may be recognized by redness and bleeding upon probing. Periimplantitis is identified by a localized inflammatory lesion, which also includes attachments around an osseous dental plant. In conclusion, teeth replantation and implantation after an avulsion is a long, difficult process. However, with the exceedingly great medical advances and physicians we have today, make it achievable. 20 years ago, the process that the patient went through in the case study wouldn't have been achievable. The medical field has really advanced. Even though the patient in the case study had to go through many surgeries, she had a result of beautiful teeth thanks to our surgeons and dentists.